Some of the things that's noticed by sort of those around the child or the concussion patient are you'll see moodiness, you'll see mood changes, you'll see more fatigue, sleep pattern changes, being tired more, lack of energy, not being able to really do what the child used to do, both from a focus standpoint, from an energy standpoint, and that's not just getting out, running around and playing. It's also being able to get through a school day, get through homework, get through classes. It's so hard to diagnose concussions, really in anybody, especially the younger kids, and that's because the symptoms are so varying, and not every patient has the same set of symptoms. And really, the diagnosis of concussion, it's really more from sort of a history and just looking at the big picture. It's not one thing that checks the boxes as, oh, that's it. There's no quote unquote test for concussion. There's no blood test or picture you can take that actually shows a concussion. In fact, generally speaking, you don't see anything when you do a workup on these patients on MRI or CT or X-ray or blood tests. There are some things you can look for potentially, but really what it comes down to is getting that story of some sudden event that happened to lead to a head injury. And those that surround the child, the parents, the family, the friends, the teachers, but also what's going on with the child himself, and talking to him or her and deciding what are they really describing. And even the younger kids can do a pretty good job of telling us if they don't feel well. And so you take that, and that's where the diagnosis of concussion comes from. And so it's more of a sort of a subjective diagnosis rather than an objective diagnosis, where it's more about the story and putting the pieces together than looking for hard and fast facts or a certain sign or finding. I think I see just as many kids that get concussions and head injuries, mild traumatic brain injury or concussions, from things that are outside of sports. So I think it's unfair to say everything is sort of sports related and focus on that, where is the best way to prevent head injuries and concussions in kids is just to be mindful of just that, just trying to be mindful of preventing head injuries. What does that mean? That means in sports, for example, you want to take the time to make sure you have the right coaching, you have the right techniques that are being taught. And even outside of sports, that you're just mindful of, kids are kids and they're going to play and kids are going to bump their heads, but taking that serious and trying to minimize that as best you can without putting kids in a bubble. They can't do that either. The biggest thing is once a concussion or a head injury has happened is to recognize it, realize even if it doesn't look that bad to begin with, to take it serious, because one of the biggest problems is not recognizing that first head injury or that first bump to the head, and then before they have a chance to recover, another head injury happens or another hit to the head happens, and they do compound over time, especially in that short time frame, and that's where you really get into trouble of having sort of a second impact syndrome or recurrent head injuries without that ability to recover, that you get into trouble. Putting the word out and trying to get out to the masses of parents, of coaches, trainers, school nurses, and really just the general public of this really is a problem and something that has to be taken serious. And, it doesn't take that much to just have your eyes open and look out and just see if something happens to your child or to a child on your team. Well, the first thing is, if you think it's happening, is that you make sure that those around also recognize it, meaning that if you think your child's had a concussion or a head injury, especially if it's in the middle of, let's say, a game or an event, or even if it's just playing in the backyard, that you recognize it and you pull that child from whatever they're doing so that you don't run into the situation of compounding the problem by having another hit to the head. If you really feel that there was a hit to the head or they're acting a little bit off afterwards, you recognize any of those signs or symptoms, or they complain about any of those signs or symptoms, that you talk to your primary care provider is what I would say is the first line. Pediatricians really, and or pediatrics offices, whoever your provider is, should be the first call or the first step. Now, if it's a major hit to the head or there's a serious concern, you don't want to wait for that. You seek medical attention right away and you go to your local ER and get checked out, or urgent care center. The most important thing for parents to know is that it's a serious problem, and even a small bump to the head can lead to major long-term, lifelong consequences if it's not taken serious. And that they should never feel bad or ashamed about pulling their child from something, or give in to those surrounding pressures of trying to keep it going, whether it's from a dad who wants to keep the kid playing no matter what, and my wife has reminded me that's not okay sometimes, or whether it's a coach or a colleague or a friend, but it's in their child's best interest to recognize it and get it taken serious and look at it. And even those small bumps to the head, you're never wrong, or you're never going to be accused of being a bad parent for caring for your child and getting them checked out. If it turns out it's not a big deal and there's really no signs there, fantastic, right back to whatever you're doing. But at least you've taken it serious and you've prevented any further injury or worsening the problem that's already happened. Our goal now really isn't to hold kids out of things for long. In fact, it's we want to get them back to normalcy as quickly as possible, but in a safe way. So it's not just rushing them back in. It's not going back to the old days of, unless you can't stand up straight, go back in and get back to playing with your friends, get back to school, get back to your sports. But it's doing it in a stepwise, staggered approach of trying to allow the kids to try to get back to some normalcy, and have a sort of a gradual return to activity, both in play, and that's play with friends or family, but it's also with school